What if you had a choice? A choice of joining a line or a choice of making your purchases online? What would you choose? While you ponder on that, the National Lotteries Authority has provided another purchasing option. All their games are now available online. Yes, Grenadians! From wherever you are, purchase your favorite daily and jackpot type games using any electronic device. Register on the NLA's website at www.nla.gd. Top up your account and enjoy online lottery gaming at your convenience. We're taking shopping comfort up, up, up several notches, but the choice is yours. Join a line or buy online. NLA, make your dreams come true.
The privilege of sampling the Golden Jubilee edition of the limited edition spice rum from the Grenada Distillers, and I must say it's something that you should try. It is authentically Grenadian, but from the flavors to the aromas to the overall taste, the blend is great. It's light, it's golden like the Golden Jubilee, and I think you can make any collector's shelves anywhere in the world. Hats off to the Grenada Distillers.
Yeah! Right along live, welcome to the ride, guys. Welcome to the ride. Welcome to the ride. Volume on my headphone, please. Thank you very much. Yeah, sounds better. How are you? Welcome to the ride, guys. Important show today, guys. It's Thursday, and today is a special day. Every day is a special day, but today is especially special because we have nurse practitioner Dr. Katina Kennedy, GYN nurse practitioner. We have so much to talk about because we only get Dr. Katina sometime once every 6 months or so. So, you know, there are so many questions, and especially for the ladies, for the men, this show is for you. So everybody share the program right now. Share it, share it, share it, share it. Share it, share it, share it. Let me do that on my end as well. Pin, share, yes, yes, yes. Nice. Hey, Cornelius, Wendell Joseph, how you doing? Welcome to the ride. Thank you so much. Isha Ventura, thank you so much. Share, everybody share. Now, we have to add, guys, that today there are a couple things that we want to talk about. We're going to be talking about. And I want to take away, you know, some people, when they hear certain terminologies like vagina and penis and this type of stuff, they get kind of, you know what I mean? Yo, this is a body part. So get used to it. There'll be a lot of conversation about your vagina and male penis and erectile dysfunction and menopause and all of these things. So if you feel uncomfortable with us saying that, it might be an uncomfortable ride for you. Nevertheless, it is for your health. And oftentimes, this is what happened, guys. This is what happened. Some people actually care for their car they care for their bike, they care for their house more than they care for their health. Yeah? But if you don't have your health, how could you fix your car? How could you drive your car? Your house is worth nothing if you don't have no health. When you're laying in bed and you're sick and you're dying, you can't go and clean your car, you can't drive your car. So this one is important more than anything else, more than the bacchanal. Let's see, Jay. All right. Without further ado, let me introduce her. She is one of the most in-demand GYN nurse practitioner on the planet. She says it as it is, and she is real. Dr. Katina Kennedy, nurse practitioner extraordinaire. Welcome to the ride.
Hey, how are you all? Can you hear me okay?
I'm hearing you just fine, perfectly fine.
Awesome. Glad to be back. Yes, it's always a fun show. Always fun chatting with you all.
It is a blessing and a pleasure to have you here. As I was saying, Dr. Kennedy, some people care for their car. They make sure they have oil in their car. They make sure that everything is running good in their house and in their bike and all of these things. But they don't take time to take care of their health, and health is your wealth. That is crazy.
Yes, and I always tell people, you have to make sure that, just like what's going in and out of your bank account, you have to know what's going on the inside of your body. So it's very, very important. I want to just start off by introducing myself. You may have some new viewers that have never heard of me before.
Yes.
But I'm nurse practitioner, Dr. Katina. I'm here in South Florida. I'm in Coral Springs, Florida, which is about like 45 minutes away from like Miami, Florida. So you guys may or may not have heard. But I own a medical practice in which I have a multi-specialty practice. So I do gynecology, I do weight loss, I do primary care, I deal with hormones, mental health as well. So I'm also a psychiatric nurse practitioner. So I prescribe medicines to those who suffer from anxiety, depression, and bipolar and so forth. So, I do it all. I'm certified as a family and psychiatric nurse practitioner. I see men, women, and teenagers. I've been practicing since 2007. And I love what I do. As you guys know, I'm also an author. I have a book called Let's Talk Sex and STDs. I'm also an entrepreneur. Well, I have my all-natural personal lubrication. It's called Sextivia. You can find that on my website. And then if you're local and you're looking for a healthcare provider, you can come and see me at my office.
You everything in one. You're like everything.
Yes, multi-specialty. But yes, as you mentioned, Junior, health is wealth. You must know what's going on the inside of your body. So I'm here to tell you guys, if you don't know your health status, you must know your health status. That's important. You must know the big three, BCB. And some of you all may have heard me talk about this for those of you all who follow me on Instagram. If you don't, follow me on at DRKATINA _ DRK, Dr. Katina _ DRK. But I have a campaign going on that's called Know Your Health Status, the big three, BCB. You've heard that, right, Junior?
Yes,
that's
of course.
Pressure, that's cholesterol and blood sugar. Those are foundational to your health. And so everything we're going to talk about today, it's important to know those three numbers because those definitely have an impact on our sexual health as well.
Yes. Well, Dr. Kennedy, you're very influential to my life. And as you know, I try to keep up as best as possible on my health. So I'm happy to announce to you that right before I came to Grenada here, I went and I did a full blood work, and every single part, everything is right in the middle in that green.
Okay. Oh my goodness.
16-year-old.
That's great news. Great news.
Not low, it's just green all the way down.
And we want to live a quality life. So even if you do have high blood pressure, diabetes, high cholesterol, it's nothing wrong with that, but it's just how you control it. It's important that you manage it correctly so that you can feel good, right? You can still function adequately in life.
Nice. All right, let's get on to the first thing. Dr. Kennedy, because this is affecting a lot of men. Let's first start with men. There are men, and women have been complaining about this, that they are suffering from what is called erectile dysfunction. They can't get it up, Dr. Kennedy. They have problems getting it up to satisfy the woman. Talk to us about what causes erectile dysfunction and some of the things that men could do to help themselves if they're faced with that situation.
So, erectile dysfunction is basically lack of blood flow to the vessels and arteries of the penis, right? So, there are so many different things that can cause that lack of blood flow to the penis when it's time to become erected. It can be mental. As you get older, sometimes, your emotional connection with the person, sometimes anxiety can cause that lack of blood flow or inability to maintain an erection. Sometimes high cholesterol. Yes, I've said it. People don't realize that when you have high cholesterol, that can be an indicator that there may be some plaque on the arteries in your body. And it's not necessarily the arteries just on your heart. Remember, we got arteries throughout our entire body. So
Yeah.
if the arteries of your heart is clogged, then the ones in the penis and the legs are clogged too. So that's why it's important to watch what you eat when it's time, come to cholesterol and lowering your cholesterol. So when you hear your healthcare provider talk about, oh, you got high cholesterol, you may not have symptoms, but
Right.
it's important to watch your diet. Stay away from fried foods, greasy foods. Make sure if you do use fried foods, just make sure you use sunflower oil
Ah,
or avocado oil, your healthier oil. Stay away from that vegetable oil. But high cholesterol can cause erectile dysfunction. So I mentioned mental, I
yeah,
mentioned cholesterol,
yeah,
also medications, right?
yes.
Medications. Sometimes if your blood pressure is not stable or certain medications that you have to take for diabetes can cause erectile dysfunction. And then also a number one cause is
Uh-huh.
low testosterone. The men just don't have enough of the testosterone. That's the male hormone. So when
Right.
that's low, that just interferes with your body's ability to maintain an erection. So first things first, I always tell you, you make sure you go get your blood work done, check your testosterone levels, check your cholesterol, check your blood pressure as well, ladies and gentlemen, especially men. We're talking about erectile dysfunction,
Yeah.
but check your blood pressure as well, because if your blood pressure is high, that can cause erectile dysfunction as well. So, some of the things you can do, I've already mentioned, get adequate sleep so you can lower that blood pressure.
Right.
Exercise really helps. I know you hear this a lot for men and women, but when you exercise, that causes vasodilation of the arteries. That opens up the arteries and that allows the blood to flow through adequately. So
Uh-huh.
when you exercise, that also helps. Also, staying away from a lot of alcohol, all that sugar that's in alcohol and sugar in the foods, all of that can cause erectile dysfunction. So eating healthy, you want to eat a colorful plate.
Yes.
Colorful. That's, your if it's a lot of whites, you need to stay away from it. That's the white bread, the white rice, the white pasta, because those ultimately turn into sugar, which turns into fat, which clogs up a lot of our arteries.
Doctor, hear this. And I didn't hear you mention this, but I'm concerned about this because I remember one time we had this conversation and you said sometimes men, they are too actively masturbating and sometimes that sort of kind of make them more familiar with the hand than
Yes.
there. So tell us about that. Talk a little bit about that. Men who
Yes.
masturbate.
So that's a good point, and this would go for men and women. But when we talk, when I was referring to that, I'm referring to excessive masturbation. That's
Uh-huh.
what that is. When you are ejaculating, 3, 4 times a day, and you're used to using your hands, right? So I have couples that come to me and they have difficulty conceiving because the man, he can't ejaculate from vaginal penetration. He
Mhm.
has to, because he's used to his hand. He's not used to her, vagina. He's used to the tightness, the grip of his hand. So he can't come inside of her. So a lot of times he have to, masturbate or stimulate the penis on the outside. And then when he get ready to come, put it inside of her. And that'll help. What you looking like that, Julia? That'll help
Yes.
to, at least if they're trying to come, if they're
Yeah.
trying to conceive, I shall say.
Yes.
So, but yeah, and then in women, you got to be careful with the toys too, ladies, because you can desensitize your clitoris. I have a lot of female patients that come in and they say, hey, my partner is giving me oral sex and I can't feel his tongue. I can't feel the tongue. He's, but because you're using the roll so much or you're using the vibrator on your clit, and that's causing the inability to for you to be sensitive down there. So you kill the nerves. And it can take months to years, depending on the person, for the clitoral nerves to actually regenerate. So yeah, you got to be careful. But that excessive masturbation is yeah, that can definitely interfere with sexual relations.
Yeah. Is there any way to reverse that? Like if you are having or you reach to a stage where your nerve ending or your clitoris or a man in a man situation is just not happening. Is there any way to reverse that over a period of time?
So not stimulating the nerve areas, and then eventually it has to heal on its own. There's nothing like we can do that's going to help it, regenerate faster. That's nerves. So, nerves has their own time of healing. So yeah, it'll take a while, but it can eventually come back. It just depends on the person.
Right. Okay. All right. All right. Here's another problem that men face, right? Men sometimes, women often complain that the man, they can't get the satisfaction because the man ejaculate too fast. It's just like it's just boom, bam, bam. That's just like that in that sequence. What could be done in that case medically to give the woman more pleasure so the man could stay a little bit longer? Talk to the men on them.
Yeah, so you have what they call premature ejaculation, and that's a real condition. So I knew what you were talking about, Julia. So it's called premature ejaculation. So
Yes.
actually, some men and ladies, you may have been with a partner where you're just even he gets so excited just before he even insert the penis inside of the vagina. Before he inserts it, he ejaculates. Semen comes out, right?
Yeah.
Guys, sometimes when you get a little excited, a little bit comes out, right? So what you have to do is, just take your time. Make sure you massage and caress the erogenous zones. Does anybody know erogenous zones is? And if you don't, erogenous zones is basically those zones that we have throughout our entire body that
Right.
are sensitive to touch. So sometimes some people, you lick your partner in the back of the ear,
Hmm.
and that might turn the person on, or the side of the neck, or even under the arms.
The arms. The arms. Under the arms.
Yeah, so some people it turns them on if you lick under their arms. And then we have under behind the knee as well, is a different erogenous zones.
Okay.
But I'm saying that to say, take your time with your partner and just, caress those areas. Participate in foreplay. Make sure you please your partner, especially if you know you have premature ejaculation. Then you want to make sure that she is to a place where, she is heightened and she's ready for the sexual experience as well. So foreplay is so, so important. And you may have to, make her come before you insert, because when you go inside, you may have a somebody put sucking of toes. So
I know
hey,
you know what.
whatever floats your boat, everything that it's just. And that's why it's important to communicate with your partner and
Yeah.
find out what makes them feel good. Now everybody might not want their toes sucked, but you got to find out what does it for your person. Make love first. You're right. Make love mentally and physically, not, and don't rush for the penetration part. And then for men who do suffer from that, they have medications if it does really get to the point where it's really interfering. They have medication that can help. And then they also have some numbing gel that some people can use to help prevent premature ejaculation.
Right. So, doctor, nurse practitioner.
You're fine, Dr. Katina. I still have Dr. Katina. You can call me Dr. Katina.
No problem, Dr. Katina.
Yeah.
Yes. What about the mental state of that individual, of a man, right?
hmm
Because some people say it's more psychological, right?
hmm
You from that school, you understand the psychology of a man going through this process. How could you
hmm
talk to a man and to calm his psychological senses, to calm him down a bit so he don't be affected by premature ejaculation like this?
Yeah, so mental plays a major part as well in premature ejaculation. Men who suffer from anxiety, they deal with that. And like I said, at some point, they may or may not need medication. I know some men, they use marijuana to help calm them down as well, some nice herbs, right? And then, you just have to use your breathing exercises, counting, relaxing. I'm not one, to recommend any type of alcohol, but some people, drink alcohol before sex, some wine just to help relax them. So those are just, some things that may or may not help, but it's really, and then ladies, you can support your partner by, just being patient, being understanding, because remember, if this is someone, especially if this is someone you're in a relationship with. So if you're in a relationship with them, you definitely want to, be patient, be understanding, and you guys come up with ways, because if this is like one of the only issues he have, but everything else is great, then, you just got to hang in there, because nobody's going to be perfect. So you definitely just want to make sure you're patient and understanding, and don't talk down on your partner. That he knows he has a premature ejaculation problem. You don't have to throw it in his face. Just, do things together, that'll help just calm him down, because
Right.
if it is related to mental, it would be, calm his nerves down so he can relax.
Absolutely. Marisa is asking, what makes a man's sperm watery?
So the consistency of a man's sperm depends on the man. Sometimes if, they ejaculate often, they may have a little bit more watery sperm. Sometimes it could be the diet. Sometimes it's really no one thing. It really depends on the man himself, because you may have always just had watery sperm, and that's just your sperm consistency. But I know the taste of the sperm definitely matters when it comes to your diet. Some men who have a, high sugar diet, alcohol, smoke, their sperm is a little bit more acidic. So, it tastes a little bitter. But, those who drink a lot of water, because, when you're drinking a lot, eating a lot of foods high in sugar, or drinking a lot of drinks high in sugar, that really makes the sperm not taste so good. Ladies, you may can, support me on this one here. You know what I'm talking about. But yeah, so you definitely, it depends on the man. Um, yeah, and their diet, their hydration factor, medications that they're taking. But they've probably always had it that way. Or, sometimes if it's too watery, maybe they're having some type of blockage in the seminal tract of their penis. So if that's something different for the person, then I would say, okay, go see a urologist and get it checked out, just to make sure.
Right. Guys, we're giving you some essential information. We're giving you information that you probably don't hear, you haven't heard in a while, because this Dr. Kennedy, she tell it as it is. She don't go around. She tell you as it is. And right now we're talking about men erectile dysfunction and early, what's your correct term, doctor?
Menopause.
Oh no,
Oh,
we ain't menopause it.
premature ejaculation.
Yeah, yeah. So we're talking about that. We also open up the phone lines. If you have a question, 718-701-5720. If you're kind of shy, you don't want nobody to know your voice, just kind of put your phone shirt over your phone. They're not even going to recognize that it's you. All right. 718-701-5720. So we spoke about the problem that men have. Let's dive a little bit into some of the issues and problem that women face. Like, for instance, painful and unpleasurable sex. What makes sex so painful and unpleasurable for women, and how could they fix that?
So, one of the problems that can make sex painful for women is sometimes the size of the penis. Also, lubrication. If she's not lubricated, and I talked about foreplay before, right? If when a woman gets a little older, sometimes it takes a little longer to get lubricated. She's not going to get as wet as fast as she did when she was younger, just like a man. When a man was younger, he wake up, penis on hard.
Yeah.
But it takes a little longer depending on emotions and how you're feeling that day. But for a woman, she has to be lubricated, because if not, that can cause painful sex. It's not going to feel good. And then if it doesn't feel good, guess what? It's going to cause her to be anxious. She's going to tighten up, and she's not going to be relaxed, and it's not going to be enjoyable, Junior.
Mm,
So, yeah. So it's important to be lubricated, and you can use my all natural lube.
yeah.
And Junior, I always talked about this. Stop using spit, man. No, if you see that she's a little bit dry down there, you
Don't
are not allowed to use spit.
don't spit.
That's right, because when you spit, that's when she can get all types of infections down there. You spitting whatever in your gums and your teeth and your tongue, you're spitting it all in her vagina.
Exactly.
Um, but you definitely want to. But yeah, so those are some things that you, and then also so lubrication, lack of just hydration in the body. Also, if she has fibroids. If she
Aha.
has fibroids, those are tumors. Those are benign tumors in the uterus. And that can cause painful sex in certain positions. If she
Oh,
has a polyp, so she might be okay with, missionary position. But
right.
when you guys are doing it doggy style, that may be a little bit painful because the fibroids are large tumors in the uterus. And that can definitely cause painful sex. So, lack of lubrication, fibroids. Also, some women have issues called vaginismus, and that is when the vagina actually contracts. So soon as the guy tries to put the penis inside of the vagina, her
Uh,
vaginal opening actually contracts,
vaginismus.
expasms. It
Vaginismus.
Yes, it's called
Like
vaginismus.
I know
Yes.
vaginismus.
Yes, and that's a condition that some women experience, and they say it's related to anxiety as well. So
Okay.
some of my patients have to use what they call dilators to open up, the vagina a little bit. They have to drink their wine to relax, or their marijuana, or whatever they take to relax. Um, and then but it's a real condition, so that can cause it. And then also menopause, when women go through menopause, they have vaginal dryness because they don't have the estrogen anymore. So the lack of estrogen can definitely cause painful sex, because when you don't use it, you lose it. And what I mean by that is, for a lot of my female patients out there, or women out there listening, when you get older and you're not having sex as much, you're not exercising the vagina. You got to exercise the vagina to keep it moist, right? So just like when the estrogen decreases, just like we have to lotion the outside of our skin, because what happens when you don't lotion the outside of the skin? It gets itchy, it
Yeah.
gets dry. For some
Yeah.
people, it bumps up, it starts to burn, right? These are some issues. The same thing goes on the inside of the vagina when you go through menopause and you don't have that estrogen to give it life anymore. So you have to make sure you keep it just moisturized as well.
Wow. Guys, this is information that you're getting firsthand here from Dr. Katina Kennedy. This is no laughing matter, no joke. This is as raw as it gets. No filter. We don't need filter. We are grown people here. We are talking about men, issues that men face sexually, and also women. Now, Dr. Katina, what could men do, right, to help the woman become more lubricated so it's more an enjoyable process for her and him as well?
Yeah. So, what can men do? Because as you age, men have to be supportive as well. So, I would say go ahead and be supportive, support, and take your time. It goes back to what I just mentioned. Do a little bit of foreplay. I see Joel said it. He named it. Do foreplay. But also, sometimes it's a little bit more than that. Sometimes make sure the chemistry is there, because you lose the chemistry, and the chemistry is important for a woman as well, in order to help just with that lubrication and pleasurable sex. So what you definitely want to do is do what you did in the beginning. Don't stop doing it. Go out on dates, date each other. If you used to walk on the beach, if you guys used to sext each other, or, send each other cute pictures, whatever you guys did before, you may want to continue that. Whatever, because if you think about it, when you first met your partner, how did your body feel when you first started having sex, with that person? You
Yeah.
were just, yes, the excitement was there. So that's because you was into that person. The chemistry was amazing, right? So the same thing, you want to try to, especially if you're with the same person for years and years, you want to keep that spark going. So foreplay, make sure you're dating, make sure the chemistry is there, make sure you're emotionally connected, and then also women go through a lot of stress, also men as well.
Right.
But
Yeah.
when the woman working, when the woman has a lot of house chores, she has to cook, she has to clean, she has to work, she has to tend to the kids, maybe one day surprise her and say, hey, I'll get somebody to clean the house, or I'll order dinner tonight. I just want you to relax. I have your bath water running, so some things out there to help her out as well. Yes, this
Absolutely.
is. Mm-hmm.
That's great. Great information. Dr. Kennedy, you spoke about the taste of a man cum, right? Sperm. Now let's talk about the taste of a woman. Because I heard you said that one time, and I want to make sure that it is, I'm saying the right thing. So you said that if a woman consume like pineapple and these sweet things, natural fruits and stuff like that, she start to taste like that.
And that's for men too. That's
Oh,
main.
really?
That's more so for a man. A lot of times when the man, drinks or eats something sweet, their semen becomes a little bit sweeter. It doesn't happen to everybody. That's just something that's out there. That they have one research study on it, but it's not significant to say that that's gonna work for everybody.
Right.
But eating pineapples and strawberries and berries, yeah, that can make the secretions, the vaginal secretions, and the sperm taste better as well. And then, like I always tell my ladies, okay, it's important to know your body.
Mhm.
So just like you have to take a look at your vagina, take a look, make sure everything looks normal down there, smell yourself. And then I also have some ladies that taste themselves as
Taste yourself.
well.
Taste yourself.
Yes.
Hold on, Dr.
Yes.
Kennedy. Hold on. Now. No, that's important, Dr. Kennedy. I want to echo that. Guys, it's not a problem. It's no fault. It is not an issue to taste yourself. Take it to the head. Taste yourself. Yes. like that.
Yes.
I want to say hi to one of our riders, our true riders, Sheba McMillan. She's in and she's watching. Thank you so much, Sheba. Guys, the phone lines are open. The phone lines are wide open. 718-701-5720. Let us take your call right now. You may have a question or two. Call us live. We want to hear from you. Dr. Kennedy, let's talk about menopause, because this is an issue that I'm seeing that even it's getting younger and younger. I have a friend, she's in her 30s, and she started to experience early signs of menopause. What's going on?
Well, before I jump into the ladies, then I want to talk about the men first. So there is a such thing as menopause as well. Yes. As
what?
men, menopause. Yes. Did you know that?
No.
So what happens is, as you get older, the testosterone decreases. Your testosterone, for those who don't have testosterone issues, but the testosterone declines the older you get. And the testosterone is your hormone. That's your male hormone. That's what makes you feel great. You feel lively. You feel energetic. When you're feeling sad, when you're feeling down, depressed, no energy, when you're feeling anxious or agitated or irritable or weight gain, those are some signs that, you know what, the testosterone may be decreasing and you're going through that menopause. So getting the testosterone checked, in men is important when you go for your yearly physical. And then, as you know, some other changes that could happen is, you develop some gray hairs on the sac and the pubic area, and women may develop this as well. So, but yeah, so yeah, it's the menopause. So if you're having any of those symptoms and you don't know why, it could be something internally going on. But with women, let's get to women. Wow, yes. Yes, because what happens is menopause. So official menopause or postmenopause is when you have not had your period for a year. And I'm not talking about if you have PCOS or you have, irregular periods all your life. I'm talking about when you're actually haven't had a period for over a year. That's when you're officially menopause. And then we check your hormones, and then your estrogen level is low. So that's a sign. And
do your sex drive, women's sex drive decrease as well?
Yes, because the sex drive can decrease because the estrogen, remember I talked about hormones. So the male hormone is what? Testosterone. So the female hormone is the estrogen, progesterone, and then we have a little bit of testosterone as well. It doesn't have to be as high as the men, but when those decline, we still feel some symptoms. So some of the symptoms of decrease, and before I get into the symptoms, you mentioned it can start as early as 35. And I've seen where, and if it does start before 40, it is, they call it early or premature menopause, right? But normally it starts, you start getting symptoms and you're going through the change when your periods become irregular, right? When your periods become irregular, and that usually starts about, and it depends on when your mother or your sister started, anywhere from 45 and up. But some of the symptoms can be irritability, which is mood changes, decrease in sex drive, agitated. You notice that, you're getting more anxious, depressed. You're not as patient as you used to be. Also, ladies, hot flashes, night sweats, joint pain. The biggest ones are the hot flashes and the night sweats for my ladies. That's like the biggest thing. And then also insomnia. They really have difficulty sleeping, difficulty falling or staying asleep. So these are some symptoms of menopause that women can start to experience, and that I don't believe men don't make your sex drive decrease. Oh, I'm just reading the comments there. But Yeah, so all of that, and then inflammation, Urus says, you start having bowel issues as well. But estrogen is so important to a woman's body. So when you don't have that, you need some things that's going to help replace that. So that's why it's important at a certain age to really, really, and I know we always talk about diet again. We're going back to diet, right?
Yeah.
But diet is key. You are what you eat. When you're eating a lot of spicy foods, greasy foods, caffeine causes constriction of your vessels. So throughout your body. So if that's tightening of your vessels. So if you're having hot flashes and night sweats, you want to relax, right? You want your vessels and arteries to be open so the blood can flow through adequately. But if you're, all tense and mad and caffeine and blood pressure's up, that causes vasoconstriction. So that actually makes the hot flashes and night sweats worse. So again, we got to go back to the diet. Also, water, and staying away from a lot of sugar. Your diet high in sugar turns into fat. Fat cells also cause a lot of sometimes different cancers, and it causes you to gain weight and so forth. So these are just some major issues when it comes to menopause with women. But some of the things you can do is get adequate sleep, eat right, exercise is key. Make sure your blood is okay. Make sure you're getting adequate iron. Get your vegetables, your fruits, and try to stay as less stressed as you can. When you're stressed out, self-care is important.
Yeah. No, you're so right. Now, Doc, is there any immediate steps or immediate medication that a woman could take once she feel like she's going through menopause, just to ease the frustration, the stress, the agony on her own, on her body, to help her through the process easier?
Yeah, so they do have some supplements out there. And I know a lot of, islanders, are big on herbs. And you guys, I think majority of your your viewers are from Grenada. But so I know a lot of Jamaicans and Haitians down here where I live in South Florida, they're big on herbs as well. So some of the things that you can do is, if you don't want to take medication right out, you can definitely, just make sure they have flaxseed oil. Flaxseed oil is something that's good. They have black cohosh. Black cohosh is a good natural supplement that you can take. Soy is something that can increase estrogen. Once the estrogen is actually low, though, you don't want to do soy when it's still high, because too much soy, if it increases the estrogen too high, can cause different cancers.
What test could you immediately take to know if your estrogen is too high or too low?
It's blood. It's through the blood. So you'll go and get your blood work, and we'll do a hormone test, and it's actually your estrogen level.
Okay.
Yeah.
All right.
Yeah.
Okay.
Collagen is good. Some people vow. Thank you for that. But yeah, so there, maca root is good. DHEA, maca is good for the sex drive. If you need something to boost your libido, DHEA is something that's good. Omega-3 fish oil is a good one as well. Ashwagandha, that's good relaxant, because when you're going through your mood changes, that that's through menopause. Ashwagandha is a good, that's an Indian herb that helps relax you as well. So I just named a few, but there are so many different things out there that you can do.
Here's an interesting question. I've never seen this question before. For the first time, I'm seeing someone ask you. Andre is asking, how do you tell if a man is a virgin? Because for a woman, there's a hymen, robust, but a man, what are the signs? Could you tell if a man is a virgin or not? Is there any?
The only thing that I can think of, and your audience can, there's nothing like medically that can show it, But, I'm thinking it's just by his behaviors. He hasn't had much experience in the bedroom. So you guys know when you first started talking, when you first started having sex, think about that very first time.
Yeah.
And then think about how you guys are now. So,
Yeah.
but there's not that I know of, any medical ways to determine that.
Right. Let me talk about men really quickly. Guys, fellas, listen this. I'm telling you this from a high level of experience, right? Don't go in the bedroom thinking that you could mash up anything, right? Don't go in there thinking that, you're going to damage it, you're going to mash it up, you're going to break it up, no.
Stop that. Yes. I hear a lot of men saying that. Yeah, I'm gonna bang it up. Yeah.
What? They care about nothing.
We call men like that rabbits. We don't want men like that. We're like, what? Like, that's okay. When you were younger, you were doing that, but we want you to caress and massage.
Yes.
Massage the vaginal walls. We want to feel it. We want you to get the penis to the spots. We have different spots. And me and my partner, we actually have an orgasmic masterclass where we talk about the 12 types of orgasms. And if you missed them,
12, Dr.
12 different types. So, and it's more than that. That's just the ones that we touch on. You got your cervical orgasms. You got your clitoral orgasms, you got your blended orgasms, you got your anal orgasms, you got your vaginal orgasms. Yeah, you got your G spot, you got your A spot, you got your U spot. Yes.
Wait, don't tell me there's a J spot too. Is there a J spot? Junior spot.
Yes. There are so many different spots out there. So, if you want to, view my online orgasmic masterclass, you can go to my website, drkatinakennedy.com, and you can view my past orgasmic masterclass. So you can go online and purchase that. I think it's only like $10 or something like that. So, yeah. Mm-hmm. Oh, yeah, the nipple. Somebody said the breast is the best. Yes. I love the nipple orgasms. Those are amazing. That means that you're just stimulating the nipples, and that's it. Nothing else.
Is that possible, by the way?
Yeah.
So if you do it long enough, is there a special technique? I mean, this is a sidebar conversation. Is there a special technique that
it depends. So it depends on the woman. So some women like their nipples clamped, so the men have to go out and buy the clamp, and that makes them have an orgasm. I have nipple orgasms personally. And so I like slow massaging of the top. I don't like biting. Biting is not going to make me have a nipple orgasm. So, you have to talk to your partner and find out what works for her. So just like when you inside of her vagina and you can tell that spot, right? When you're having sex, you can tell when you get to that spot, she's like, don't you move, stay right there.
Now, I hear that a lot, by the way. I hear that a lot.
Okay. All right, Junior. You the pro.
Wow. Yes. So nipples orgasm.
Yes. Nipple orgasms. And then some people have what they call mental orgasms as well.
Mental.
Yeah. So just by talking to them, intellectually. Yeah. They can have an orgasm that way.
Is it that you use like big words?
For some people, that's not my thing, but for some people, when you talking to them, and you say, oh, I love the way you are so intelligent, and let's talk about this and that. And they're like, ooh, I'm having an orgasm.
No, but that one. Really? A real serious orgasm by using words.
Yes. And then Angela says she loves when her husband suck her ears. So again, I always say, and you've heard me say this before, Junior, nobody should ever have a bad sexual experience.
Nobody, especially as an adult, you should never have a bad sexual experience. And why is that? You should always communicate with your partner. Let
Right.
them know what you like and what you don't like. And remember, each person is different. So
Yeah.
not all people like for you to stick your tongue inside of their vagina when you're giving oral sex. Some women like to be choked and slapped. Some women don't. Some men like to be pegged. Some men don't. So you have to communicate with your Junior,
Doctor,
your face.
you know about that pegging thing. You tell me about that. And to each his own, doctor. To each his own. That pegging thing.
Yeah. So some men like to be pegged. Some men like their nipples licked as well. Some men like their anus licked and blowed in and put some ice on it. Again, it's how you communicate. Some men like for you to use hands when you are sucking their penis. Some men don't want you to use hands. So again, communicate. Some like fingers inside of the vagina, some don't. So you have to communicate with your partner. If it's something they don't like, let them know. Just say, no, baby. No, I like it when you do it soft. Take your time. Yes, lick it just like that. We too grown not to be having good sex. Everybody should be having good, fun sex and
Absolutely.
healthy sex.
I agree with you. That's why communication is important. Because I heard someone said there that they like when the man moan, right?
Yes.
In some of the cultural things that in the culture that we live in, if a man is moaning louder than a woman, we have a problem, Houston. Houston, we have a problem.
Yes.
Why so much?
But a woman likes that. That'll turn her on. Just like some women are pleasurable. Like they will get very, very wet from them sucking penis. If they suck the man penis, some women love that and they enjoy it, and that turns them on. That's them. But so you so you have to talk to your partner and find out what they like.
Yeah, guys, this is Dr. Katina Kennedy. And I think my internet. Are you seeing me properly, Dr. Kennedy?
Yes, I can.
Okay, you see me properly. This is real talk, real conversation, right? The real conversation. And we're not telling you nothing that you don't know. That this is grown people that having this conversation here. And it's important to have real good sexual relation with your partner. That's going to guarantee that you guys are happy. Because if you don't, doctor, what if you don't? What are some of the deficits, the problems that you might face if you don't have that sexual relation with a partner?
If it's dependent on the partner, unfortunately, there may be some infidelity. There may be some infidelity. So that's why sometimes today some people have open relationships. So sometimes when one of the partners, they make great partners, right? It's just the sex. So I've had many patients where the man, their size isn't, big enough for the woman. So they have to use what they call penile extenders. So they have to put something on the penis to make the penis a little bit bigger.
Penile
extenders. Yeah. Extenders to extend the penis. So if the penis is only about 2 inches, then you put something on the penis, just to expand it. So when you're having sex, then, the woman is finds pleasure in it. So there are so many different things that you could use. I know ladies sometimes like to be dirty talked to as well. They like to be called, different things. So yeah. Marva say extender. Yes. Yep. You got it.
Okay. All right. Guys, 718-701-5720. We're talking to Dr. Katina Kennedy. She's not here all the time. She's very much in demand. If you have a question, please call right now, 718-701-5720. I'm watching the comments. You guys are funny as hell, but I want you to call 718-701-5720. Doctor, let's talk about things that you would recommend for couples, again, to keep that love, keep that sex life active, Keep that relationship juicy, because again, you're not from only from a GYN perspective, you're from a psychological perspective, a relationship perspective. Give the folks again some recommendation of things that they could do to keep that relationship sweet, sexy, sassy, and beautiful.
So you want to know your health status. Go get your blood work done. Make sure you're healthy on the inside. Listen to some music. Feel good about yourself. Be there mentally. If you're not happy within yourself, you can't be happy within your relationship. Everybody keeps talking about the rose. Everybody talking about the rose. I told y'all earlier about the rose. Remember, I said the rose. Now, if y'all overuse the rose, it'll cause damage of the clitoris. So y'all can use the rose, but don't use it, overuse it, I shall say. I see y'all talking about the rose. Yes, it worked wonders, but you want to make sure your partner can also please you as well. So that's another issue when you're masturbating alone, and when it comes to actual sex, then because you're used to using toys, your partner can't satisfy you. You don't want to get to that point. Use it with your partner. Have fun together. But yeah, so it goes back to what I was saying before, just dating each other, sex each other, do things, dress, and then you have to make yourself feel good and as well. So put on some nice clothes. If you really feel good in your tight, short dress, ladies, then go ahead and put that on. Put on you some heels or your best panties. Men, put on your nice Speedos that you may have, or your nice sexy underwear. Men have those too.
Okay. Professional here.
So we're going. So I know it looks like Tavina asked. She posted quite a few questions here.
Okay, let's
quite a few. We can't get to them all.
Yes.
But
what's the name? Tavina. Okay, Tavina. Right along. Please ask. Okay, let me see if I can put this up on the screen. Please read my question. Education necessary. Okay, hold on. Let me see. Tavina.
All the way. It's 1849. It says, what are the most prevalent reproductive health issues affecting women today?
Okay.
And what steps so the prevalent reproductive fibroids, PCOS, polycystic ovarian syndrome, which causes infertility. So fibroids, PCOS, diabetes, hypertension. But as far as reproductive, those are the ones, your fibroids and your PCOS, those are major ones that truly affect us. And really with those, it's your diet. As far as the PCOS, it's the weight loss. And because it's your hormones, and then sometimes it's just your hormones. So, but those are the ones. Number 2, let's see, could you elaborate on the specific components of a GYN exam? So the GYN exam, when you come in for a well woman visit, that's what we call it. We do your breast exam. We check your breasts. And then we listen to your heart and lungs. We check your lymph nodes. And then we do a vaginal exam. We do the pap smear, where we actually scrape the cervical cells. And then we also check on the inside with our fingers to check for any pain, to check for any tumors or things abnormalities that may be present in the vaginal cavity. So that's usually what's included. And then some people do blood work as well. Yeah.
Right. But I want to talk again for the few minutes that we have left about STDs, right? And do you recommend, or what are some of the STDs that people could possibly self-diagnose? They could kind of feel or see that this is something that they need to go to the doctor for. And do you recommend women and men check themselves regularly, and how regular they should check for different type of STDs?
Yes, definitely. Oh, I'm glad you brought up this topic. As we know, STDs can be silent. We call it asymptomatic, meaning you might not have any symptoms. HIV is the number one STD that is transmitted without symptoms. So the reason why it's passed on so rapidly is because patients have no symptoms until, if they got AIDS, right? That's the end stages. of the HIV, but you have no symptoms, unfortunately. So it's important. Yes, you definitely want to. Now, if you, because I deal with a lot of swingers, a lot of porn, people who do porn. So if you're having multiple partners, then you definitely want to get checked, every 3 months, because it takes 3 months for like antibodies to build up in the blood and so forth. So if you get it checked too early, like I've had patients to come to me and they, had sex the day before and they want to get checked. And I'm like, it's too early. We can do it now, but it won't tell us about yesterday's encounter. So depending on the type of STD it is, it can show up anywhere from 2 weeks to, 6 months. So it's important to get checked every 3 months. If you have multiple partners, risky behaviors. They also, if you do have multiple partners and you don't really use condoms, remember they have the PrEP, which is medication that helps prevent you from getting HIV. I hope you guys know that that's out there. There's medicine that prevents. Okay, good. Glad you guys know that. But yes, so every 3 months. And then if you're with one partner, and you're just there once every 6 months or once every year is fine. But yeah, if you have risky behavior, if you're having multiple partners, hey, you're single. You're out there having fun. There's nothing wrong with that. You just have to make sure you get tested often. Some of the symptoms that one may get would be abnormal vaginal discharge. It can be green. It can be yellow, but then that can be a regular yeast infection or bacterial infection as well. Men, you may have some burning. Men, you probably had an STD before in the past in your younger days, but you may have the burning when you urinate. You may see the discharge, the green or yellow discharge come out of the tip of the penis. So that's chlamydia, that's gonorrhea. We talked about HIV. It's silent. You really just have to make sure you get tested for it. Now, one STD, and I talk about this in my book, that is, I've had aversion. I had aversion. She's never had vaginal penetration coming to me, and I diagnosed her with genital warts, because genital warts is skin-to-skin contact. People forget that. So even though, let's say, for instance, there's warts around the head of the penis, right? And he's, playing, you guys are bumping and grinding, and the warts, he's touching you down there. He's just not going inside of the vagina, but he's playing with you down there. That's how you can get genital warts. So please examine yourself, examine your partner before you put your mouth on anything. And I always tell my teenagers this: look at the penis, look at the vagina, and make sure there are no warts. And you guys can Google warts and see how warts look. And then herpes is skin-to-skin contact as well. So if you see any blisters, or if you have a cold sore, fever blister, don't go having oral sex with your partner, because you can transmit the herpes virus to he or she if you are having oral sex and you have a cold sore. That's herpes, the herpes simplex virus.
Oh, in the cold sore.
Yeah. Okay. So if you have a cold sore and now just by having a cold sore, that's not a STD. Okay. But if you have oral sex on the partner that transmits the genital area, then that's the herpes simplex virus type 2. So that's important. And then you still have the crabs that are out there. I don't know if you guys remember crabs. Yeah, but that's when you have really itchy down below. And it's little mites down in the pubic area. Men and women can get that, and it's very contagious. Yeah. I actually had a college roommate. Well, not my college roommate, but a girl who lived in the dorm. Her college roommate had crabs, and then it was transmitted to her roommate because they travel, because her roommate sat on her bed. That's how, it's little lice, it's mites. So it's called, we call it crabs. And then you have trichomonas that's out there. You have hepatitis, herpes, genital warts. It's
You make
quite
me,
a few.
making me scared to even talk to people these days. Like, you want to catch no crabs or nothing. Wow. What about odor? What about odor?
So the odor, so that doesn't always have to be an STD. The odor, it can be trichomonas. So trichomonas, is a common STD. It's actually more common than gonorrhea and chlamydia. A lot of people don't know that. A lot of my same-sex partners have get trichomonas, especially my female same-sex partners. They get trichomonas a lot. So that one can create a fishy odor. But with women, when you have the fishy odor, sometimes it's related to the bacteria vaginosis or yeast infection. That'll be like that cottage cheese type of odor. But if you get that odor, that means there is something going on. It means the vaginal pH is altered. So you have to stay away from like a lot of scented products. Don't douche, stay away from the douching. If you get recurrent yeast infections or BV, don't let your partner ejaculate inside of you all the time, especially if you have sex often, because sometimes the semen can throw off the vaginal pH, and that can cause a woman to get an infection. And then also, if you have to do the tongue check. So I always tell people, do the tongue check. You stick out your tongue, you look in the mirror, and if you see that your tongue is coated in white, it's very, very white. Now, we're going to have a little white coating. Right. That's normal. But when there's an overgrowth, that means that you may have some yeast on your tongue. Yes, we all have.
And you could transmit that to the woman.
And you can transfer it to the woman. You got it. So I don't know if you guys follow me on Instagram, but it's at Dr. Katina _DRK. And I talk a lot about just hygiene tips. I talk a lot about health and fitness. And I talk about checking your tongue as well. And also, I don't know if you guys use a finger condom, but finger condoms are out there as well. And then your dental dams. Using your dental dam when you're doing oral sex can help prevent or transmit, chlamydia or gonorrhea, because you can actually get an STD from oral sex as well. So you have your dental dams that are out there. You heard of a dental dam before, Junior?
I heard about it.
Nice. So a lot of people don't use it, but it's out there.
Yeah, and this is very valuable information. Very valuable, because people sometimes go out and they just have sex wild all over the place, not considering that all these things are still out there. So you have to be careful. And some of them you could even catch even if you're wearing a condom, right? Because like the crabs thing, crabs all over your area, you just transmit.
Yeah. And then also genital warts. So if he or she has warts down there, on the nuts area or the groin, and then she has it on, we call it perineum area, then it's skin to skin contact. So she can, it can be passed on that way. So it's really about knowing your partners and just really examining, taking a look. Don't just dive down there. Look at it first. You look at your food before you eat it, right?
Turn on the light.
Yes, definitely.
Great information. Dr. Katina, listen, we could chat for a whole year, because there's so many things. I really appreciate you. Let me see if there's anything else that we needed to talk about. So we spoke about the men and erectile dysfunction. We spoke about women experiencing painful and unpleasurable sex, self-diagnosis and diagnosis of STDs, the best practices for pleasurable and enjoyable love-making experience. Is there anything else, Dr. Katina, that you think the audience must know?
No, just like I say, just communicate, know your partner, know yourself. Even if your partner can't make you have an orgasm, you should be able to know your body inside and out. So if you have to ride your partner, and you should be able to make yourself have an orgasm. So you can't just depend on your partner to make you have an orgasm. You have to know your body, play with yourself, explore yourself. And like everybody is saying, I mean, communication is key, diet is key, knowing your health status is important, getting adequate sleep, drinking your water. And just remember, and this is the last thing I'm going to say, in order to carry out your purpose and passion in life, you have to take care of yourself first. You can't take care of anybody else without taking care of yourself. So please don't ignore the symptoms. Don't ignore signs. Go get your mammograms. Go get your colonoscopies. Go get your prostate test. Take your vitamins. Do it all.
Nice. And it's important. It is so important. It is so important. Dr. Katina Kennedy, I really appreciate you. I really appreciate you taking the time to come and chat with us.
All right. Until next time, make sure you follow me on at Dr. Katina _DRKATINA _DRK on Instagram. And then if you want to buy my orgasmic masterclass, you can go to drkatinakennedy.com. So Dr. Katina, Katina, Kennedy.com. And that's where you can, buy my lube if you're in the States. And then you can also buy the orgasmic masterclass if you want to know the different types of orgasms and how to elicit those orgasms.
Nice.
And it's always been a pleasure. So until next time, I love your audience. They're always so involved. I love it.
Yes. Absolutely. Again, give us the website one more time so the folks could stay engaged with you.
Sure. It's follow me on Instagram or TikTok, Dr. Katina, DRKATINA. All right. _DRK. Follow me on Instagram. Don't miss out. And then my website is Dr. Katina Kennedy. If you go to my Instagram, and then you can also go to my YouTube too, Dr. Katina, because my YouTube actually has videos from years and years. So it might be a topic that you actually want to hear about that we didn't get to talk about today. If you go to my YouTube page, I have years of content on my YouTube. So YouTube is where you really want to go.
Dr. Katina, thank you so much. We'll keep in touch as always.
Take care.
Goodbye. Good night. Wow. Guys, before we go, and thanks again to Dr. Katina, guys. Check out on our Facebook page or YouTube or TikTok, all over. Dr. Katina is our go-to GYN. She is also a nurse practitioner. She is the best, right? This program is brought to you with the kind compliments of Geneva's Cottage, guys. Geneva's Cottage, located in the Woodlands area. How could you miss it? Guys, if you're looking for a great place to stay, if you're looking for an amazing place to stay while you're in Grenada, let me show you guys some pictures, guys, because we got to big up the people who put their money where their mouth is. You're looking for a place to stay in Grenada? You're coming down for character? Let me tell you, this place is so amazing, so adorable. It's so welcoming. Washer, real nice furnitures. Everything is there. It is Geneva's Cottage, guys. Write this number down. Put it on your refrigerator right now. Call it right now and say you got the number from Right Along. 718-531-0189. Call Geneva's Cottage right now. Sponsoring this edition of Right Along Live. That's 718-531-0189. That's write it down. Don't forget, this program is brought to you with kind compliments of Geneva's Cottage, located here in the Woodlands area, close to the airport and everything else. 718-531-0189. Guys, let's take a quick commercial break. I'll come back with my closing and final thoughts.
You initially said that you thought the Supreme Court would have a difficult time. Your quote that I looked up today was, avoiding the consequence of the plain language of the 14th Amendment. It was obviously a 9-0 call today. So I wonder, what you made of this ruling and if you feel differently now.
But I'm certainly not here to talk about the 14th Amendment, the U.S. Constitution, the Supreme Court, Donald Trump, nothing like that. In fact, I'm more interested in finding out what's happening in the Caribbean. I'm more interested in telling you what's happening in the Caribbean. In fact, I want to invite you to Grenada. And when you get there, you have to be a part of the Riders e-bike excursions and tours. Now, every Sunday, we take you out on a trail inside of Grenada. Best opportunity to see the interior of the island. But if you don't want to get that adventurous and you want to go on your own thing, you could walk into the Esplanade Mall, nice mall, as soon as you get off the cruise ship in St. George, and rent an e-bike. And you could ride around the tongue of St. George for the entire day. Low price, great price, excellent fare. Now, this is more important than any 14th Amendment, guys. I'm telling you. When you come to Grenada, you check out Riders e-bike excursions and tours. Yeah, Riders e-bike excursions and tours. Even if you stayed in the hotel, yeah, we'll get you your e-bike. So you could go to the beach or night out, whatever it is. Check us out inside the Esplanade Mall. You could even call us at 473-422-1011. That's 473-422-1011. Riders e-bike excursions and tours. Get with the program. 14th Amendment, Donald Trump. I just don't want to talk about that.
Everybody got the gloves? All right. Yeah, Ride Along Live is brought to you by Ride Excursions and Tours, guys. Don't forget that this Sunday, we're riding again. We are riding again. This Sunday, we're in St. Patrick. Yeah, we in St. Patrick, man. We in St. Patrick. St. Patrick, look out for us. We coming. St. Patrick, look out for us. We coming. Now, you two could be a part of this ride, guys. We have 2 bikes left. 2 bikes left. If you want to ride with us to St. Patrick, we have 2 bikes left. This is what you need to do right now. Call this number. Call this number. Call this number. Call this number. No. 473-422-1011. Let me put it on the screen. 422-1011. That's the number right there. Call it. And book for this Sunday. We're going to St. Patrick with Ride Excursions and Tours, guys. Now, if you want to rent an e-bike, you sure? Yeah, you want to get on the e-bike, right? Just to get the wrong tongue, you could also call and come in and rent your e-bike. It's Ride e-bike excursions and tours.
For an exhilarating adventure, then look no further than Ride Excursions and Tours. Get ready to explore the great outdoors like never before with our powerful e-bikes. Discover breathtaking sightseeing tours around the island. Feel the wind in your hair and experience nature in its purest form. Now, whether you're a seasoned rider or a beginner, our e-bikes are perfect for everyone. Call us at 473-422-1011 to book your excursion or visit ridersebikes.com. That's ridersebike.com to reserve your spot. Unleash your adventurous spirit with Ride Excursions and Tours, where every journey becomes an unforgettable adventure.
What if you had a choice? A choice of joining a line or a choice of making your purchases online? What would you choose? While you ponder on that, the National Lotteries Authority has provided another purchasing option. All their games are now available online. Yes, Grenadians! From wherever you are, purchase your favorite daily and jackpot type games using any electronic device. Register on the NLA's website at www.nla.gd. Top up your account and enjoy online lottery gaming at your convenience. We're taking shopping comfort up several notches. But the choice is yours. Join a line or buy online. NLA, make your dreams come true.
Development Authority of Grenada, PDA, is enforcing regulations to curb illegal, disorderly, and unauthorized development in several locations throughout the state of Grenada. The authority is concerned that structures mainly associated with vending are negatively impacting the environment, has undesirable public health and sanitation consequences, present obstructions to vehicle and pedestrian traffic, can become projectiles during adverse weather conditions, and generally affect the aesthetics of the nation. The PDA will work along with stakeholder ministries and institutions to effect the demolition, removal, and disposal of structures which fall in the category of illegal and disorderly development, commencing January 2024. In this regard, persons who vend in or occupy such illegal structures are advised to secure their personal belongings and have the structures removed ahead of the planned PDA demolition operations. These actions of the PDA have become necessary to safeguard and protect public health and the environment, ensure the safety and well-being of all citizens and visitors, discourage any future disorderly construction, and encourage compliance to regulations pertaining to physical development in the state of Grenada. This is a message from the Planning and Development Authority of Grenada.
Right Along Live is brought to you with the kind compliments of the GTA. Yeah. Guys, don't forget, if you're flying to Grenada, JFK to Grenada, there are a total of two flights per day from JFK to Grenada. Fly JetBlue into Grenada. Get here quick and fast. Check out jetblue.com. Affordable rates coming into Grenada. Fly JetBlue. And you guys want to know why I get here so quick? Oh, I'm here all the time. And then you see me, I'm back in New York. JetBlue, making it possible.
Ministry of Tourism and Economic Development and the Grenada Tourism Authority extend a warm welcome to visitors and returning nationals visiting for Carnival and summer vacation. We do hope you enjoy your stay with us, and we invite you to return with friends and family to celebrate our 50th anniversary of independence on 7th February 2024. Tourism is my business, your business, our business.
Yeah. Thank you guys for watching. Thank you guys for being a part of our program today. We really appreciate you. We really love you. Listen, guys, it's serious, you know. Your health is your wealth. Now, some people spend so much time, as I said, making sure that they have the premium oil in their cars, in their bikes, right? They take so much good care of their bicycles and their house and everything else. But inside, they're smoking a pack a day. They don't exercise and they don't even go in and do a checkup on themselves, right? This is your wealth right here. If you don't have health, you don't have nothing. You don't have nothing. The car will just sit in the driveway. The car will just sit in the driveway. Somebody else go drive it for you. All the money you made, somebody else go spend it for you. Seriously. Your health is your wealth. Take care of yourself. I am happy because, you know, one thing, I do my checkup. And I just came back because I told the doctor right before I got here, I did a full physical, full blood work and everything like that. And, you know, it's good to see that everything is like right in the middle. It's not high, it's not low. It's like, and I'm blessed. I feel energized. You know, I feel like I could be for another 100 years or so. So I ain't getting rid of me anytime soon. I'll be here happy. And men, listen, if you having any sexual related ailment, you know, you feel like you're not performing, you can't do what you're supposed to do. You know what I mean? I forget to ask the doctor about the blue pill because some men, they go a little bit too far, they take the blue pill and next thing they have heart attack and all of that stuff. All you need to check on yourself because, you know, if you take the blue pill, that don't mean that it cure your problem. You know, it might accelerate, you might be able to perform at this minute, at this moment, but that doesn't mean that it fixes your problem. So before you're going to pick up the blue pill, try to figure out why you're in that position where you're not getting up like that, right? The blue pill might accelerate so much blood into one part of your body, but at the end of the day, you got to take a next blue pill tomorrow. And what will happen? So check that and make sure you know why your thing is not saluting when it's supposed to salute. All right? I know I don't have a problem. None. I feel good. And that's why I'm going to be here for a long time, guys. I'm going to be here for a while. Thank you for watching. Thank you for being a part of our program. I want to big up my homeboy Walker and Grenada ice cream. I'll tell all you more about that. That brother, let me tell you, the best tasting ice cream on the island. You're licking all your fingers and them. I'm telling you, Walker and his Grenada ice cream. Look out for it. You could be hearing much more about it right here on the Ride Along Live. For if you have a supermarket and you want to add ice cream to your offering, you know what I mean? I'll give you the number, the contact. I tell you, I tasted that ice cream today, and there are so much different flavors. All kind of thing, watermelon, mango, the most set of flavors. You swear, that come from some, people think that they can't make them thing of them here. You swear. That's the best ice cream you will ever taste. So, Grenada ice cream, Walker and the crew, big up all yourself. I'll give me a taste of that ice cream today. I'll lick all my fingernail. You shouldn't do that because, but it went through there and I didn't have more. I suck out all the things, right? So, anyway. Thank you, guys. Hey, Mr. Neckles over there at Clarksco, thank you so much. Big up all yourself. I'll take care of all yourself, eh? Love each other. All right? Catch you guys tomorrow. Peace out. Don't forget, guys, if you want to advertise and Ride Along Live, we encourage you to give us a call, 473-422-1011 in Grenada, or international 718-701-5720. Check out our excursion this Sunday, and it's happening in St. Patrick, but you need to book tonight. Call this number right now and book for your excursion on Sunday. Geneva's Cottage, big up yourself. Thank you for the sponsorship. And we encourage you guys to also check out Geneva's Cottage, located right here in the Woodlands area. Call and book now. As I told you earlier, don't stick. Peace out and good night.
With us and reach millions daily, weekly, monthly. Yeah, over 10 million per month. It pays to advertise with us. Reach more and let us send your business viral. Advertise with us and reach more.
Thank you.